Good afternoon, everyone. Good afternoon. Thank you for joining us today. As I straighten out some housekeeping business here. All right, so got that out the way. Good afternoon. Once again, my name is Craig. I am a recovery coach here at Capital Recovery Center, and today this is our family support meeting. This is very important that we incorporate not only the individual, but also collectively the family member as well, because addiction is a family disease, not just the one person that abusing or using the drugs, excuse me, are being affected, but the entire family. So today we're going to bring you an article by familyintervention.com. If you like, you can go online. You can retrieve this article. It's brought to us by familyintervention.com. So without further ado, let's get into the actual topic of today. Understanding how family roles and behavior affect addiction treatment outcomes. All right. Once again, this is our family support meeting, and today's topic, understanding how family roles and behavior affect addiction treatment outcomes. So the article talks about or give us a topic into the segue of the conversation, and that is what enabling provides a family system. What enabling provide a family system? The article says a person enables for various reasons, often having little to do with person suffering from a substance use disorder. Most people understand enabling a substance use often takes away their ability to face consequences. The question is not so much what is the enabling providing for the substance user, it is more so what is it providing to the enabler. Okay, good question. Not only what is the enabling providing for the substance user, more so what is it providing to the enabler. All right, and so what are the enabler getting out of this enabling the one that's using? We're going to find out. Family focused strategies for addiction intervention. It says, addiction affects family members differently than you may think. When a loved one begins to use drugs or alcohol, their relationships with others begin to change. Everyone reacts to addiction in their own way. However, a substance use disorder often brings more problems and devastation into the home. Is it the family member with the substance use causing the chaos and confusion? Good question. Is it? Could it not also be the family member's attention to the substance user that is causing the maladaptive roles to form and the resentment with one another that follow, right? Now, could it be the substance user or could it be the family member that's bringing the chaos and confusion or maladaptive roles, unhealthy roles? We understand how difficult it can be to see what has happened within the family system. One of our many goals is to educate those affected by addiction and help them see how the whole family shifts and why. Okay? Let's dive into a little further. How does addiction lead to dysfunctional family roles? If I was to ask a room full of people who or what is the problem, they will almost inevitably say the addict or alcoholic and their behaviors. Although that is undeniably true, it is the only problem. It isn't the only problem. Family members' underlying resentments and anxiety causes them to be as much, if not more, frustrated with the primary enabler and others within the system. This often causes the other family members to fight and be at odds with others' views and suggestions. The primary enabler can cause an internal struggle for the attention, affection, and approval that has been almost entirely given to their loved one with the addiction. The family often makes it about the alcoholic or drug addict, creating a diversion from some of the internal problems that needs to be addressed. Misplaced emotions, resentments of others, lack of education, acquired maladaptive coping skills, coupled with the lack of communication between family members is often the culprit. As a result, family members take on counterproductive roles within the family system to help them through. Families who are flooded risk being able to change effectively and unbiasedly due to misplaced emotions. This is often why just talking to them about stopping their addiction fails utterly. This approach does not address the big picture nor the underlying family problem and only scratches the surface. All right? Let's talk about some of the bullet points that the article highlights. It says substance use disorder causes family members to take on maladaptive coping skills and become flooded in their ability to make rational and effective decisions. Substance use disorders turn family members against one another. Family members start to acquire reason to avoid helping their loved ones. There is often sometimes gain by holding on to certain family roles, such as the hero or the enabler, who seeks to remain feeling needed in the relationship. The family member often approaches the problem from the direction of the substance use being the primary problem. Our research shows it is far more effective to address and repair the damage to the family system before help can be offered effectively. Right? So, family members avoid confrontation and the fear of rejection. Creating ambivalence and confrontation is proven to be the most effective method to move a substance use disorder client through the stages of change when applied therapeutically and professionally. Family members frequently find objection to solutions offered. That is so true. We had we had we had someone that was reviewing or watching or participating in the one of the group meetings. I believe it was this one here, the family meeting, and they was at odds with the professional help being offered. So, as the article says here, family members frequently find objection to solutions offered. All right. This is often due to unresolved and misplaced emotions. Some family members unconsciously avoid the steps required to help their loved one in order to hold on to new family patterns of confusion and chaos. Okay, and I hope this information that I'm providing or sharing is helping someone in the long run. Because a lot of times we may miss the mark. We may think that it's all about, or our focus should only be on the person that addicted to the drug or alcohol. However, we should also look at ourselves if we are a family member and try to seek some help for ourselves as well. The longer maladaptive family roles are left unaddressed, the more damaging and lasting an impact they can have on the entire family and their loved ones. Okay, the longer it goes without being addressed, talking about the family member, not just the person that's addicted, but also the family member need to get more educated, to be more informed, to address some of the issues that they may have with the person that's addicted to drugs, and their own personal behaviors or relationships that they may have with their loved ones. All right. So we need to clear this up and get more healthy, not to bring unhealthy behavior or unhealthy roles to the situation. Family members often blame the addiction as the cause of the family problem, when the problems more frequently stem from the family members reaching to the other family roles. Okay? Let's talk about another interesting point the article makes, and that is family roles that often occur within a family affected by addiction. To better understand how these harmful behaviors can prevent effective solutions while affecting the family, we'll identify the most common inherited family roles. Please keep in mind that many of these roles can be an extension of others and exist simultaneously. Okay, it can be an extension of one situation or behavior, or they can coexist altogether. The substance user is the role that draws the most attention, and for obvious reason. Substance users act out the family's untreated guilt and shame while self-medicating their own. Okay, the chaos they create others forces all others to react to it. The addiction starts the process for the primary enabler, which in turn initiate a dynamic that forms all the other family roles. That forms all the other family roles. The substance user is often viewed as the only person who needs to be fixed. And family almost never realize this isn't true until the substance user enters a rehabilitation facility. Once the substance abuser is removed from the family system, the roles played by others further degrade, and the family starts to break down. Fortunately, this is a temporary situation. As the family works its way back to a sense of normalcy, learning to operate without the chaos and reactivity caused by the substance user and others playing roles, the sooner family members enter their own recovery, the sooner they can start to function as a healthy family again. The primary enabler, let's talk about them. This role, primary function, is to react to the substance user. What ensues is denial, minimization, accuses, and attempt to manage a failing family system, all the while continuing to provide comfort and care for the substance user. The enabler role creates a trickling down effect that inflicts significant devastation on the family. While most families believe the substance user is the source of all the resentment and grief, it is the primary enabler who has the greatest impact on the family system. This family member often feels the need to enable as it provides something rewarding in return. Otherwise, he or she would not do it. By the primary enabler taking on this task, other family members and relationships take a back seat to the substance user, and this leads to family disruption. It is frequently played out due to guilt and shame and perpetuated by the satisfaction of being needed in the relationship with the substance user. You see what took place here? The other family member has been taking a back seat while all attention is focused on the substance user. All right, and so now the enabler feel that they are the one that are doing the most good, and in all actuality, everyone is suffering because of everyone's behavior not getting the right information or coping skills and things of that nature. The matriarch, let's talk about the matriarch, is the family member seen as the victim of the substance user behavior. The matriarch is the one who screams for help and then rejects help when offered. Wow, let's read that again. The article says, the matriarch is the one who screams for help and then rejects help when offered. In a group setting, this person can be seen as the yeah, but client. Although matriarchs are truly affected, their fear of change and what will happen to them resulting from an intervention or their loved ones seeking treatment is prioritized. The matriarch may think, for example, if the loved ones leave for treatment, how will I pay my bills? The matriarch is not a bad person, but is terrified by the prospect of a new normal. Matriarchs may not even realize the true reason for their objection to an intervention. The question the matriarch often struggles with internally is what happens to me if the substance user improves? Where my role is, where do I fit in this new normal? The hero. Let's talk about the hero. The hero is an overachiever, a perfectionist with little ability to listen and follow suggestions from professionals or others. The heroes seek unconsciously to sabotage efforts to help the substance user. In doing so, others are prevented from improving the situation and ending their roles. Heroes impede others' efforts to be in control from becoming, instead of them, the savior and shining star of the family. The hero has to be seen as the one who fixes the problem and thus is resentful of the primary enabler. They at odds with one another, the hero and the matriarch. They at odds with one. The substance user does well one day, and the enabler is overjoyed. The hero has several accomplishments for many days, but earn far less recognition. Heroes are angry and medicate their feelings with perfectionism. As with the martyr, matriarch, well, I said the martyr, not matriarch, the martyr, there is a hidden agenda. If the substance user gets better, will he or she gain more attention from and become a hero in the eyes of the chief enabler? All right. So this is a great article touching on some talk about the martyr, we talked about the hero, we talked about the primary enabler, and we talked about the substance user. And so, as the article made mention, these roles can be an extension of one another, or they can exist simultaneously. All right, and so there's 4 different behaviors here, or 4 different entities that can play a major part in the family being affected by addiction. All right. And first one is the substance user. Second one is the primary enabler. The third one is the martyr. And the fourth one is the hero. Right? So there's more. There is more. The scapegoat. Let's talk about the scapegoat. This role acts out in opposition to the hero as the family system balances out and complements the dysfunction. The scapegoat sees that the perfectionism and overachieving ways of the hero are unsuccessful, so they become defiant and oppositional to draw attention away from the enabler. Scapegoats often search for new people to associate with and build a parallel family of friends and acquaintances who understand them. Like the other roles, everyone is trying to draw attention away from the primary enabler who has given all he or she has to the substance user. We believe human connections are so profoundly needed that people will do just about anything and everything they can to achieve and maintain them. Let's talk about the lost child. This role sees both the hero and scapegoat roles as ineffective, so the lost child goes silent and withdraws. Many clinicians feel the lost child is attempting to go unnoticed. We disagree, the article says. In several interviews with those who have adopted the lost child role, we have found them attempting to be noticed by eliciting concerns for their withdrawn behavior. The lost child is hoping someone notices the withdrawal from the family and asks him or her to return to the fold. This strategy, similar to the one adopted by the hero and the scapegoat, also backfires until the substance user is in treatment along with the other family members. These roles would not start to return to a state of normalcy. So everyone needs some type of help, type of treatment, some type of therapy, some type of counseling, right? And then the last but not least is the mascot. As suggested in all the other roles, mascots have strategies as well. They use humor and jokes and make light of the situation to cope with the trauma within the family system and themselves. They pretend things are okay while actually making it more difficult for others to get better. By using humor and jokes, they offer the family the illusion of normalcy and divert attention from the chaos and confusion. They may be laughing on the outside, but they are crying out in pain on the inside. All right, and so we covered a host of uh, individuals, family members who have taken on different roles, whether it be an extension of one or the other, or whether it be simultaneously trying to focus their attention on the substance user and neglecting a family member or themselves. And so the article says in order for them to return back to their role or normalcy, they have to find some professional help. All right? Find some professional help. Let's go on to another topic, and that is no one chooses their role or behaviors intentionally. No one chooses their role or behaviors intentionally. The roles stated above happen over time. Most people we speak with are unaware of why or what they are doing. Some get angry or defensive at the mere suggestion of exploring their role. It is these roles developed over time that largely in part perpetuate the family problems and provide less want or need for the substance user to change or family to change themselves. Most family members believe they are being helpful and their current beliefs are valid, normal, and possibly one day effective. While the family is held in these roles, the substance user accelerates by creating a diversion. The addiction destroys the family system, leaving many unaware of what is happening. The attention is frequently on the substance user and infrequently on the family. What ends up happening is the family is fighting one another and are at odds because nobody is on the same page. Some enable, some try to impose their belief on others, trying to prove their stance, and others may wipe their hands of the situation altogether. When all come to the same agreement, guided by a professional, solutions become clearer and easier to execute. It is helpful to identify and repair the family system that may be preventing the substance user from seeking help. The closer is a loved one who is to the alcoholic or addict, the less likely they are emotionally capable of formulating proper judgment. Emotionally attached family members are often flooded and unable to correct the problem internally. It almost always requires a third party perspective from the balcony. If a family expects their loved ones to surrender to professionals for a new perspective, it may be helpful for those affected to follow a similar course of action. It can be very difficult to know who is helping and who is hurting without an expert input. That's why working through the problem with the help of an intervention specialist is so vital. Emotional driven decisions and those made in a flooded emotional state can be difficult to deliver effectively. Those members affected by the addiction are almost always unable to simultaneously be the counselor and the family. There is far too much going on, making it near, if not entirely impossible, to see the forest before the trees. All right? And so that is a conclusion on us. And we're going to talk about the last one, and that is when family changes, so does the addiction. It is important for family members to know what they are up against. Let me read that again. It is important for family members to know what they are up against. This includes identifying family roles and behaviors that may affect positive outcomes, knowing what a substance use disorder is and how a family becomes consumed in it allows for better judgment and decision making. In any other aspect of medical conditions and care, most families will allow themselves the opportunity to learn from professionals, right? If it was a different disease, people would step back and take the advice of professionals. With the article says, with addiction, it is often not the case. Families who suffer and become aware of how the addiction and their behavior is impacting the rest of the family is the first step towards achieving the goal of positive change and awareness. All right? And so let's be informed, everybody. Let's be vigilant, mindful, respectful, and know that the greater good is not only to help the substance user, but also to help every family member, no matter what role that we may be taking on, because the article says when families changes, so does the addiction. All right? And so that's it for me for this week. Until the next week, take care of yourself and love on your family members, and also always seek professional help when professional help is needed. You can't be a family member and a counselor at the same time. You may have but there might be some bias. So allow some outside help if possible. Make the assessment, find out if this is the best fit for your loved one and yourself, and you go from there. Okay? Take care. Until the next one.